All right. Let's go. Mama, and you're ready to grow to Jason. All right. I feel like a DJ. Welcome everyone. I will leave it for my host, Lena, the host, to do the introduction. And Lena, please, if you're comfortable, feel free to get your camera on, but take it over from here.
All right, thank you very much. I guess my camera is already on. I don't know if you can see me from where you sit. No?
From my end, I don't have a... People in the comment section, can you give me a thumbs up if you see Lena's camera on? Because I don't see it on my end. But that's fine for now.
Okay, that's okay. We'll manage it.
We'll figure it out.
All right, so wonderful people, this is the very moment we have all been waiting for. And before I take all of us through what we're going to be doing today, it will be very prudent, very good for us to share the link. We want to share the live. We want to invite people on, especially if you know anybody who has concerns concerning autism. You want to call the person right on here because Doctor is seated and ready to help us understand, know certain things about autism. And so tonight's live has been dubbed, Let's Talk About Autism. Let's talk about autism. I also want us to know that if you have any questions, if you have any concerns, please feel free to use the comment section because we will be looking at the comment section from time to time. If at any point in time you cannot hear from us or you can't see us, you can also draw our attention to that because we desire to give you the best of what we promised you. And so we are going to roll straight away. One other thing I want us to know is that this live is going to be, aired every second Saturday of the month, every second Saturday of the month. So it has been structured in a way that, we will take it bit by bit. Yes, and it was actually supposed to be for the Ghanaians here in the diaspora and also way back home. But we got concerns that people who are non-Ghanaians would also be joining us. And so we'll be doing our very best. We have spoken together with Doc, and so we'll do our very best to mix the English together with the Chi Fanti, just like I told you in my video that Doc is very good at, mixing these things. So it's going to be a cocktail, so to speak. And so as we roll, we would want to go straight away and find out for today's topic that let's talk about autism. I know you have questions and I do have questions as well. Doc, autism, what is that? A very short word. What is that?
Let me actually start with a question that I think Bernie started with. Like, can autism be healed or it just gets better? Because I know of a normal guy who was autistic at 5. Okay, so let's start there, right? So autism is more of a neurodevelopmental difference. Dear Trina said, and please, if there's anybody here who doesn't speak Chi, give me a thumbs up so at least I know that there's somebody here. But for now, I'll be mixing it like I said. So autism, if you take autism itself, really it comes down to say nipakrono nadwini adwuma a little differently. Oh, inti empempi no de ma autism ebeye problem ne say society na yetim no nkrofo bebre adwin ye adwuma a certain way and na oni akrono autism no nadwin ye adwuma almost in a way as to a lot of in a lot of areas of life no quite opposite to the way nkrofo bebre adwin ye adwuma inti no na all society ni and I don't know. That's what neurodivergent or neurodevelopmental difference really is. Autism nankasa de a neurodevelopmental difference. Now sometimes people forget said there are severities to it, and also be between your autism now when you're at the forefront work home into no bema everybody and but what doing autism as autism in higher briefly, what doing autism kwa hodia autism not just say akorano and as one yakrono. Nadjin and Nemebia, the way Nadjin Yedman, are quite different from the neurotypical. Only a cry or more autism, the way Nadjin Yedman. Oh, ain't Obi or her baby, the way Nadjin, the way Yeduma Ewono, ain't no, Ebia, what if 5 no, or school of a because the teachers persuade any must say, or no one tears aside the current also any sa, Tina or Ebia, me fancy or not troubles with school cry. But with time, no for church and name for church and I say the parents in ya about school in ya about church and name I say osunya. On to never be and be a 5-year-old, 6-year-old old school no ebe who naturally no. Across autism, I was so train. But unya hunsua now it be all good for a while there. Inti Ben is akrana or can I say no OD5 no. Ebi na or bre or sa quiet so. But as all in the church and in no. Now they are getting better at living with other people and engaging with other people. By the time I will say only autism. Yes, autism ni cool. What they've gotten significantly better at engaging with people, managing the symptoms and dealing with people. I guess the short answer to Ben's question is say autism doesn't go away. To say the American because it's not and area in the same way I be malaria, cholera, and I said even generalized depression when I call. Autism nakasade is just the fact that Nigerian Yajuma a little differently. They know they are, but they have gotten much better at engaging with the environment and with the society. Until Lina, the short answer to Wolf's question is what autism is. Autism not just say only a chrono, not doing a little differently than where the average person is. To me, like I will go into a little more detail the symptoms that we actually look like when we're talking autism.
Right, thank you so very much, Doc. Enti utrechwe ye muno na o se senia nipa krono adwene no emifa say enyini no different from other enkra ma menka ne sa different from other enkra but say ye call ye krom ebibire mu Ghana so to speak because e na me free enti I can speak about Ghana enkofo perceptions bi omo wo etirimupo bi say autism no either say eye abeyi fo yare anase eye enome anase eye akra na so odin che say broni be fe ne mates say brofo ne dem na mutimi ka ne kese omo wo sinimupo bi obi kwati bi ka say nikoja akra ne kwan mi di ni kosi ahomachi anase anadu da suom di akra ne kosi ba bi eja ne kwan me pa chew eno e de na obeka de afa ho
every now and then I get really hopeful that as a society, I think we are much better. I don't think that these days no for that's what they in room they could job anymore until there's been some progress. But then so abakako hunu and be pa now you must show video I think say I briefly I don't know so that send me an answer my adra. One more send me say my maybe says about autism that's what say autism ne kona so start kasa. You see, the dandelion na would you go swim for 3 days? Now was she at the go a snail shell. Would the dandelion now was so cool for say 3 days or so then would you go snail shell him now the macrana and so come there crana for side dandelion in soon and I'm from my oban no see. Pray am about autism a continue washing out the infection in the bicumba. What the bacterial infection in the bicumba because you want to get rid of about autism. And you may be over sebe. Yeah, now I understand. Say, as parents with ground autism, you're desperate. Like we want as much solutions because we are exhausted, we are tired. I get it. I promise you, I get it. More money, no me won't cram me, no me in our autism. Until I get it. Hello, bra cram until I promise you, I get it. Yes, I make a kind of pet because maybe I told me, yeah, me timidebia. Until I get the desperation. But one thing is, so I'm not ukutiti a myth CB na sepsebe. Wako how bano and things are even worse. Until me srow. Sa mates na nkrofo can simple how I would say to say oh sa somebody accepts a binyansen baby a technology adri baby we see adri what do you mean say akra autism yin suba what do you mean say akra or ADHD yin suba you understand I don't get it until missing the that's what and we'll break it down but for now no please I need you to understand say so oba autism or yin suba oba ADHD or yin suba again to say the makano Nigerian Yajuma a little differently. Woman support, woman the structure, you will be surprised at the progress I will be, and I know said there are levels to it, and I guess I'll speak to your question as well. When it comes to autism, right? As psychologists, you're diagnosed with autism. Your levels, so your level 1, level 2, level 3. At least, what you say, Hanosana, you're categorized. Meaning people in different countries, if it's a little different. Now, some people are more about mild, moderate, severe. Into be me in your autism or your level 1. And now you say as Hanka Senior Pacono or like language issues and okasa. So okasa or level ben wedru, and san ya san so actually nipa chrono or intellectual difficulties and ni even so ya san hwehwem se unia chrono or another medical or genetic condition. Now we can see you, Lina. Asante ya bisa so unia chrono or another medical or genetic condition now. It's me obi o high diagnosis or autism level 1. Only any language issues, not only any intellectual issues, and only any other medical or genetic condition. Only a chrono, say I can't show crana and shall who saw autism. Oh, and I obiso between autism level 3, which means the symptoms no a severe, and on kasa into language impairments, and I said the little assessment I about intellectual functioning and also error from intellectual impairments, and or sign war ABA Down syndrome, and also sign war sickle cell like SS, and I say or sign war cerebral palsy. Into your private side, the actual day-to-day life no or best struggle, right? Because of all of these things that are bosom. But unfortunately, your community, and pen bring of 40 autism, they only think about level 3, no language, no intellectual impairment, intellectual functioning, or sour cerebral palsy, sour Down syndrome, that's what sour fragile. Like you said, nama akwada bakono. Oh, in the parents,
That's just dog mean chawano. Dog mean chawano. Wabo area I mean mean can say conditions ahodoɔ bebree wabo HDHD baby am one no you cannot add her S wabo and also wabo Down syndrome wabo conditions ahodoɔ not just say ne nyina ne different and me patcho ma yema yetifo no enhu where to draw the line kakra na fe yento aso nhwe enkofo perception na omo no obo levels B any B.
I like with the alcohol. Oh, in Pembebre, no, yeah, Jane, maybe conditions and cry a warmer almost struggle with that. And you will be say, oh, we are, Ubabinya autism, we are, Ubabinya autism, 1 winter, Ubabinya autism, 1 year, Ubabinya autism, into your day, and like developmental conditions, na aqua autism. Oh, and I'm not saying, sir, maybe a developmental conditions, no, it be a chain. But so a description and I say a picture of it, no, Emma autism, it increases stigma na autism no so no. Into bit say you say neba autism because in yamin pengu because in the mind no neba nte se akosiaba neba nte se kofiba. Kofiba na wahuna autism. Yes, na me ba nte. So what do you mean say me ba autism? But maybe a wo ba no autism level 1. Kofiba no autism again, say you as a hand, Kofi Bano autism level 3, esa wo way count. Oh, either way, no, so now you Kofi ba, when I Kofi cry na, oba wo autism say, no, Obeka send yamin penguin, yan never ma autism nako. As I was setting some autism na enko. Nemo no send ye, utie, wakuma pum, then you will be say, okay, what I was saying about autism, and dear, na meet me a yabuan. Oh, but I want there be also conversation you could see. Oh, to the fans of the Okanya in Pumukra now born pay we are was okay. Me ban, dear, I met me a yabuakodan. Oh, but I think most of us know because of baby day, Yadina Kosa what autism. Hi, Dr. Felix, baby idea Yadina Kosa what autism is Nintino. Yet say autism and ye imagine say film. Because in our minds, it's the quote unquote worst possible thing I bet me imagine say a babico. Oh, Obisumpo ha ebi a diagnosing about with autism. Again, it's a spectrum. It's maybe a baby and a banner one, relatively, quote unquote mild. Only any other concerns to be account. Anka what they need to form go with me up one bano with speech therapy, occupational therapy, and as a support our crying here, school, any fee near them. But also I'm on in them pipes. Into that time now, debates not near crano, I hear and near my baby crano, or in them pipes. Oh, nothing said who progress be now bonya mesomo obo fia before mosomo but time now ka the bet na fee any akrano aye and never want to be now their home improvement and I would die at mountains no shade to at mountains what I say but obo mpa kakra now the intervention no aka what I say early intervention here pa into the longer you delay intervening the more difficult things become as I say into Saudi say why looking Doctor B and I say Obia I do attention about so say obey me who anyway nti e be a who specialist and I say who Obia. That is where you say okay Martin no who specialist no. You don't say nyame mpangu na wonye ho hwe because esa na eventually no symptoms no eba na afi wankasa ne akra ni na mabrabo aye den more and more and more. Oh, enti no mesrɛ nyina what say oh baby ɛwɔ condition be a ko professional. It could be autism, it could be ADHD, it could be cerebral palsy, it could be Down syndrome, it could be Fragile X syndrome, it could be fetal alcohol syndrome, it could be a learning disorder, it could be intellectual disability. Oh, already my about 8 off of the top of my head.
Right. So broad is that.
There are so many different things that could be going on with your child. And there's something called global developmental delay, which global developmental delay means say obano like over like the course of the life, there are so many aspects of the life or you're delayed. Maybe an casa yet. Maybe even the physical, development, form kakra, the social skills, form kakra. But they don't necessarily have one specific thing. They are globally delayed with their development. Akorasa, eventually they catch up. But it's with support. To do with me, I would have global developmental delay, but only autism specifically. But Sisia now would say, Abia, wono, would do any more because, we are a cry, the way I will behave with Sisia, Sana na a brefi banisano, Nani Subaiti. Now, one sakrano autism. Now, wouldn't now Ashia Mountains. In Tabia, Ashia Mountains now, Okobompaye, now a cranny ni 7, no, I start to improve. A year was set. I mean, again, no shade to empower. A year was set. Some people na obano improve, but a beer na akrano a global developmental delay, which then with time and support and no spontaneous results on its own. Like again, it's just a delay until when they catch up, they're good. And no different from obia, a diagnosed with autism, and that's obia or no profile no autism or no profile be a little different. Into developmental conditions, no, there are so many of them. Say I have a small and I have a small pet peeve with when you didn't now question autism, right? Because it really doesn't help anything. I know say there are times maybe I will be kasana or parents if whatever this are all kind of seriously. So as a parent, so when you say like as a parent, unyim, that's the one manage your stress levels here. Your body releases significantly higher amounts of cortisol, like stress hormones, and very recently there was a case I think it's a dancer, high dancer. There was a case Accra, Nepami was going through significant trauma. Or by Accra behavior up onto say I think Accra 3 years a day, there is enough reaction to trauma. It looks like or PTSD. Accra, albeit me diagnosed with post-traumatic stress disorder because on one case through trauma. Sana Accra behavior because some was saying Nemami went through that much trauma. Me too before say as a parent, Mr. Rosa, when you making sure say you are managing your stress as a father, make sure say you are not adding to the stress and you're helping your spouse manage the stress. Na say make say yes, I will be autism. I said, oh yes, I know some percent only are chronic taking it seriously, but I don't just say me fan question autism, right? Because some of it isn't autism related. What I say bit me too for. Bra won't call about autism because the autism almost like we are using autism as a scapegoat. I want to no problem on. We are using autism as a scapegoat for every developmental condition, and it muddies the waters too much. Emma, and many precasing between naba. And we
kind of prophecy.
It muddies the waters. It makes things difficult to actually tease apart, right? It makes the advocacy difficult, right? Because if I'm here maybe giving suggestions about things that a parent can do to help their child with autism, it won't apply to somebody whose child maybe has cerebral palsy, right? But in his mind, in his or her mind, they are all autism. Doctor, maybe okay, in my head, and so me progress or her. But that's because your child doesn't have autism. But in your mind, autism in etc. There are times where who be back say, me ban your own facial features etc. or autism. But autism doesn't have a facial presentation. Down syndrome is one of the conditions that a facial, presentation to it. Into you are here thinking it's about autism, but when they have Down syndrome instead. Into then you have to see a specialist and as a provider or Down syndrome expertise and not Dr. Louisa or as a psychologist or autism who in my high Caleb. Let's recognize that it's a very, very broad set of things that people, developmental delays and disabilities and conditions and around autism. Please and thank you. Lena, are you there? And I will be from Wasmaisi. All right. So let me see. Okay, I don't think I've missed any questions, but maybe I say a little soapbox I'm a course on Mr. Moa, you didn't come out. And my everything and share autism because nina and yet autism. Now let me see. So while I wait for Lena to find her way back to us, let me see if I can answer some of the questions that are in here. Okay, client needs different intelligence. Okay. So I can't take the child to I can't take the child to Ajagraja for prayers. So I can't sit here and pretend to say Lena, you're back. Okay, go ahead. So I'll take your next.
So right. So my network has been acting up, but we will manage it. We're gonna. So you've already taken us to the next level. What I wanted to actually find out, because we are still on Ghanaians before senior yetimu poor any senior junior eda yetimu say autism no ebi a bibi so boni bi obi boni bi a waye and I say senior na wo kan obi kra obi say enyini bi a wenyini ache ansa na all wonti na ede no akopie ho and wabobobo nyo maybe eso edi amaye ansa na me baby sa the second question no me pacho mo fa mo nsa emobo ade ne so emaye se ne be ya live no ebetini awo ho ede amaye nti no mo power tap emfa amaye and I follow dog so I me pese o follow no because the information now or one no just too much. Follow me nafi yetimi ede abrew every second Saturday of the month. No, we are doing this together because of the love we have for you. If I just say if you are joining us and you don't speak the Ghanaian language, let us know. Let us know. Ana se wo hanso na bia ye ka brofo bi na emu odu. Na wo hia se ye be cheche nsem budi atira wa mepacho na wa twen ya dwen enso ede akoso. Yo, dog, ade ba kwa mepese mi bisa se edie nti na se wo hwa edie be mpanti na emanipa enti sa condition yi asi a obi e ka de ope. Se enye se bia na ye hia wa ha obi e uhia obi a ne de all kan edifa ho, especially if you don't meet experts and I say yenya animdie for it say monum say me bacho I salute Dr. Ifa and say me hu say waba live ne so Dr. Ifa o ha ye chia wo yeah edien o hwa edien ne bema ebi mu entimi nya the right information na ama enunti no aye yese me bacho obetimi abobo ani kakra amaye.
Right. Well, so just like anything really, I don't know. If I say, let me start here. As a coach and Ghana for I say there are so many things I as a sikanifia, kakra benyano. You have enough to be able to go to the pharmacist. You have enough to see a doctor regularly. You have enough to see a dentist, account doctor. The level of money you have to be concerned about mental health at the time, and I mean, Ghana, no. I just said, what did I say? What cash bar? We are so much just struggling with our basic needs, and then maybe what am my own common. There are so many conditions, and kayon common because and no, that's too much. That's too many steps away. Imagine say be a parent or no, they have enough money to even take their boy child to school. Needs to take their girl child to school. So what was some developmental delays, sir? What do you think? What do you think that child will gain? As I said, because me enough na me baba ma school. Minya kakra me no bi mane boa me kakra na me baba na ka ho. Na wo akra na wo no all of these concerns no. Me ni wo husika. Me ha me ho. Me, when I was growing up, there was a family that lived to the left of our block. There was a rock could be a veranda be. I guess it's a comdina. No, did he? no anum nsuo. Unfortunately, no to me obekwa ebi abetwa mo no asɛ ne ho enwura ne parents ba no be fana ko inside no cleaning it up and I guess so my don't be na Canada. The next day, the same thing. Oh, and unfortunately, no, at the time, won't mean blame omo because omo wo enkora omo also omo koye adwuma e de betua even na kora na kora no be si ho no e also omo koye adwuma e de betua ne home medical bills ne what you call it aduane ne ade. Oh, it's sad. Like I don't want to judge them, but it's so sad because he entered in the corner said oni nkrofo bebre ha especially mama mo te Ghana no o ka chen say go and see a psychologist. I was doc me ni hu sika nkra no mo yare kra na me nya sika for mo ko hospital na wo se me nsan ko hu psychologist cash of the bed gym no me nya hu sika. Oh, inti enkomo no endru ho for many of us no enkomo no endru ba bia ye betimi ekohu professionals no match mu ebie mu ach. Oh, many people don't
Yeah.
know about what autism is, and it's not because we don't have access to those professionals. Oh, and I'm super glad that myself, I think Mamiajo has been doing a great job with the UK community. Abrefi is doing a great job. There are so many parents and specialists who are having these conversations to, excuse me, to
Yeah.
make it more commonplace. Oh, see, I think that with time, more and more people are getting familiar with, autism, ADHD. I mean, I do so much work on my platform about ADHD, right? And that is helping us all. And Dr. Alice is doing a lot of work on trauma-based things and other mental health things. It's never boy in who say Akrabi go through something. Oh, sa eyoya. Oh, sa eyoya. Ni bitin ya baby. Oh, and hopefully, as the society, move, set kakra resources, does, buy, more accommodations and stuff like that. Ebema, oh, Joe, ebema, near basani, my way home. Oh, because I think so ultimately, so near chronos, so koko who say autism, can I say, untimi, unisika, or the call speech therapy, and that's what the call way, and that's what the bay who do mana. Now I say, okay, me who near a day. Because meet me, we need support to get them out, see, it really, honestly, for the most part, it comes down to lack of information or lack of access to information. Hey,
Dog, Obe can say, Obe sounds what Obe Jatu Musu say, Obi Honoma, information here available, but ebi ana let me just generalize it. I mean, so that you bit mienya anu yene ye say ebi before packing kind ebi before person make us share information and because baby is a brochure akonya no wo ho enso ebi before me nuanom Ghana for say impo obi the information ni bra ye kra na as we are even pushing information no away as if say we are not ready for it. Is it that yeah person be fa bibi ni akenkan ni ehunu obi so bo modin ase or ka kire ya enti eye die ben. I wish I could get those people to ask them, but
a fana you here, okay, like people, we are not piecing it together, right? But there are certain things that are almost luxuries. I say because Lina, if you not say come do who the ya, and you say kofa book kinkai. Because come do we move draw. Oh, and many of us grew up in systems where surviving was the priority, right? And if you're just trying to survive, then you won't go out of your way to look for information. You understand? And of course, with time, it becomes cultural because, well, who say, oh, papa, yet no one who saw my mayor, well, who saw near be it's a baby, I will what drew no, maybe I would do what did you. But and you are doing some kind book because we know who will be a kind book for leisure. Oh, ube who be kind book and just a school now force on the one kind. Oh, and many of us don't seek new information, not because but because culturally it's almost a luxury. Like when we were growing up, it felt like a luxury. Library. What I say? Who say the incredible call library? And just never pan my muska. Oh, na senkanya some sort of library so I book no what that. Cook cabin or befi no. Okay, yes, for us. Oh, so there are so many things that would trace in the back, trace, and it comes down to what at the time looked like lack of resources, right? There was no money, there was no privilege, what they call, even in the pre-independence and so on. oh masa ma okwan ya woni ho ase ko kenkan book. Oh, into our tendency to not read and I said not research new information. And yet debia like yen say yes, I say ye nana I say essay any sebi concept in kwa on a year.
Yeah.
Like you have to do the work to almost kind of get out of that, right? Maybe problem kakrani ye with omwa information ni wo hopa wuti o say me free me so dog. Ni ona beg chem me. Oh, how they do when I me hu de men kan.
Now I say, and family who attitude be I don't care. I say the basic BNC
And I
case
said,
around
yeah, the old training and meet I just said because me suffer say, bit me a bumpire my way up into no old and I would train no and yet mamma. The old train said me family back and go psychologist now on your assessments now. We are my speech therapist as an etianica and they will and don't know what to do. And I feel so you're not even telling me, say, oh, psychologist, no paper family bano. You're not giving me any surety to say in 2 years' time, me bano be abeko autism nebeko. Me sort of say autism nebeko, or say me nko, who psychologist and me speech therapy. But I think me view because me suffer the no na air the suffer no catch me no, and no na air Oh, and a piece of that, honestly, you nipa. It is will be more information and know the air that, and no na biti. Oh, until so for na jo cash I'm our kwanche we ya nye no anu asa be catch us say uni jidinti na we ya nye because Bible say faith without works jidi hunu you understand you know into sometimes no the soft na catch no ed chance say wa we kwa kunsa because na say be kwa hwehwem now this knowledge no account pipe no anytime we talk about these things I want to make it clear say I'm not suggesting say nyame need to me nyame will to me ba. Oh, no, the 2 million nyansan, a psychologist, or the 2 million nyansan, I'm a therapist, or the 2 million nyansan, I'm a occupational therapist, speech therapist, nurses, doctors, or the 2 million nyansan, I'm almost or more wow. Into no power more. Ube bomb pie na won't feel because one here or tin baby also about Passia, mede a one et one chain wapeno, et yet your friend, mean your day. Oh, into no. You can see says as we are making kakra munkafra say mama fire kakra mo fan chairman
Edika say eto de bi na say yamfa eja engugu yeso a ye betina be bia feel comfortable and say na make no emfa ye ho ani say bia wo ye wo hope we be say ade no say na be ye but the truth needs to be told. Say na be ya we will sit up, we will wake up and pay attention because me won so be a throw comment section or ye be honum say ade we abeye so rampant enyini I had to say almost every household biano condition bisa and a related condition bisa it was half yenim. No, it's about time say you bit me nim dear. Say one of the songs that we need to me nim dear enemy ancestor. No, that is why I gather wa yeah gather nim dear any nyansa no. It is very, very important. Say, if you just joined us, we want you to know, say, this is a program that has come to stay. Yes, we have thought of you. We love you so much. It's about time we all got to, gather information about autism related cases like that. And this is actually supposed to be a Chi or Akan version, the fancy version, but there are people joining us who are non-Ghanaian speaking, nationals. And so we're going to be mixing the Chi with the English, as much as we can. And so Dr. Louis is the one doing this with us. Yes, our community psychologist, our area psychologist, we would call him. Thank you so much, Doc, for the wonderful work you are doing. Please power tap and make sure that this live is going on because we don't want it to be taken away from
maybe I see a na say nkofo questions I bet me aba na sa na ibi o man ya friend baba question because it's a bit hard to track comments na a comment section hono or me na me afa so.
Yeah, right.
But our question, especially
okay,
feel free to come. You better accept to ne no. Me patcho Mr. Alba no me too na ye kasa. You via near Joe question on you better try to take it one person at a time. Na obaso no nya botrama ye. It's not be brave. Once again, if there's anybody
and then again,
please let me know in the comment section.
Right. Good. And another thing is that you may ask a question. Today we are focusing on what autism is. We're going to take it step by step. We will be coming here in January, the second week of January. And so there are some questions you might not get the full answer. Maybe just the gist of it you will be getting. This means that you have to be in class. You have to be present. Make an episode. We will not go back to what we did previously. So today is the premiere edition, the very first of its kind. If you missed today's session, when we come in January, it is not likely we will be going back or we'll be coming back to what we're doing today. So please, as much as possible, try say you back all the time. Now, me I follow sequence, so that we don't miss out in anything. So if you have questions, if you have anything bothering your mind, you want clarification on or clarity on, you can request to be brought on. We'll address whatever issue there is for us. Yes, Doc, Obi Becca said, and I said, someone would want to find out what are some of the characteristics, the core characteristics. A dear bay, Newman, the bay, will be say, oh, mebano, way or condition, no, and I say, a way autism, and I said, way a ADHD, and a dear bay.
Yeah. Okay. So for the purpose of a NEP conversation, I think we'll stick with autism. So autism is primarily a social difference concern. Once they make us say it will be between our autism now our other things are come. Oh, intimate for a brief moment, you forget the other things it make autism autism nankasa it's about the social difference. The autism symptoms, at least again for US, a diagnostic and statistical mind when I use autism symptoms are a 7. A mood 3 has to be present to our 5 4 na can the mood 2 abesoso to diagnose. 3 na e wasi who are first one say a bano say on nipa on any young nipa yes day-to-day conversation common back and forth near the na smooth. Like I said, akrabo ha ushia na ye krom for na bi kra because akrabo dey ofere dey papa. When you sakra on when him like unya no kra mani mi na no nchero. Upie hwa na aso ono no akwahye na ho kra dey agro ha umfi omo. No kwahye no baby on engage on that social emotional reciprocity no. Akra no oni sad no ho. Eno ne ba ko. The next one difficulties with non-verbal communication. See bi do ha as a parent, watching in work and say, hey Jai, no. Like I said, also when so it doesn't mean anything to him or her. Yes, what's in the one for you? Like, hey Jai, no, why when you can away hey Jai, no, that's why you be because we feel some mood, bro. May Baba man, which and said, hey, Lion, go and get that. What point, not on us why you say. But instead of someone didn't need call baby our point, the average 7-year-old no point baby or share baby our points na at the crowd chain work. Maybe no point here. No, so Edna, so I think you can already be see. I was supposed to say, so grown in a yedi. It is and only number 2 difficulties in non-verbal communication. Now, the next one, really, may more as a consequence of the first 2. Difficulties developing, maintaining, and understanding relationships. Only across with me she open our questions. Oh, who of a new like this is your uncle. As long as on any background NTV. Oh, okay, fine. You say this is my uncle. Oshiano watchna obey treating background said you only baby, because really no, minimu, you are my uncle, yes, but I don't know you like that. Yeah, NTV, minu needs a relationship. The fact that we're uncle.
You love me.
The fact that we're uncle, no, it's not going to make me all of a sudden kind of like you any more than I would if you weren't. The relationship uncle no doesn't make a difference to them. To difficulties understanding relationships. For a good part of their lives, they will be at the outskirts of friendships. They really tight relationship with the nan for. Ebi onya ba kubia na ba kono nan for abaye ono so nan for. Tide bia no na ase ye twene ba. Like obi say nkrofo kwa no so kobi. See ye party na say so wonua. See ye party anka nyi na nka invite no. Because ono no oba on sheda nye social sa nti be invite no because ni nia no ebeba bi. Na ebi anipa kono ye party no. Untimi invite like in na onja no it's no invite mu nyina because ono ankasa de ebia onye as much social in those relationships. Into those three social issues have to be present. The other four na emu two I see you know back repetitive motions. Akra bi wo ha ebia sort ho na so stress kakra obi hu na like or you say you look at them and say I don't know cry or yes like hand flapping obi wo ha na or you say na or rocky ka ho obi so how na on the tipitos. But the basic idea then is that there's a lot of behaviors who I was there. I didn't know or yes the behaviors may not necessarily be bad though. It's just very different and don't seem to serve any purpose. Oh, maybe say time osano or man a car, a truck, I wouldn't say a truck would demand the average at the time it was 2 years or so. If you give the average 2-year-old a truck, or the back of or no the truck no man, no they are fun elections to say. Anytime I've man a truck, I don't know what they find. It's those repetitive behaviors, and only is one of the symptoms. Another one, difficulties with change. And Caribbean will transition from one thing to another, they cry. Autism, one of those any symptoms now. And I'll be who say yes, levels womb pa. Oh yeah, baby. Man, I said turn this one. I said no pa. A one or pesa debia. Yeah. Me baba. Yeah, kofia. I was see be garage no near firm. Said that me kofia be a car garage no more than tell me park you outside no. Into your side door. Into keep it my park you outside. Near you side door no. Emma so. Obesun sa be 13 is not as soon because yeah me garage no I'm for more. Osano first no na opese ye wo Alexa opese o solite na e was catch no ma wono no cause opese no so catch no ma no kodum no but there was this one day me catch into on cause solite no na o ye last na me catch Alexa ma Alexa e cause so ye usumia be 15-20 minutes this time me catch okay sadi okay do no next time so difficulties will change. So or baby say ya sa no nyanke be no esesa kakra bi a etimi cause no significant distress. Onene kasa even omo be or take kasa ono so timi kasa chira ontimi nchima de krunti a o so sa about something seemingly so small. Or chim so won't ase but a problem pa. Difficulties will change. The next one is sensory issues. Maybe I would say, Adena, why is my child so picky? There's a particular food and no everything else or they on percent into it. Everything else, maybe a fat texture now, the way it feels in the mouth into only. Ukushia, you will be fear or be boy my way to by force. And I say a common better because na better the no fear. But the issues made this is how I think about it. Say imagine so be ama wadiani bi how do go anuma it say anwea but when you are say Gary. The fact when you are say Gary doesn't change the fact say when go anuma it tastes like sand. Until we day the thing that it tastes like sand it won't become my favorite. Bit me abomi. A comment to me dear me deep and sa but I will begin to not like it. Sometimes sensory issues the texture. Maybe so atade bi maybe one of the more common things to say atade what like the tag in atade a can hope and I say be atade say too tight and I say feel the seams a can body na a problem we feel na vacuum kakra bia obi say maybe our other nkora wo fear o catch them say daddy is about to vacuum na okay. I can understand say o start vacuum na ebia obi embeshe no eno ne normal na ebia 30 seconds later na wakama down akra autism na or that symptom no o start ya why should you na obesa tie ma we lucky dia any ordinary service na sum say ordinary service ma kopim say obewi small sound bi kra bia akra wadwen ma so no ono han so wouldn't crash it BBC cosum. And the last symptom, I think many people know about this, restricted or fixated interests that are abnormal in intensity. Yeah, the performer and not just said, a chronic me war like an interest area, BB or or pepper antino or snia unimuhunia bebre what you want to say.
Oh yeah.
Who didn't come be na assign about sad the corona interested in this one. Sad way a blessing and a curse when it comes to autism conversations. Because if you heard me, I may say symptoms. No, there are 4 symptoms. You hear 2. Intinya korebia no was symptom no. Nya korebia autism bia no was symptom no. Obi oha de omo no ebia sa area no ebe piano. Inti onim piano mu niam bebre ni mo until be obey to say kodili or bonny piano now while teacher who say yes obi na piano nene or the eno no etimi e develop obi why books and I say math and I say science and I say engineering and I say computing into obi how nim computer mu pa minimum obi wa me mutual bi wa piece or sin the bane de na mass until akra bi sa no or te mass papa until or name bi a it then make them come across as very quote unquote special because or was that area now there is significant interest with nimsad in mupa but new be aba and was that symptom no intimate say focus across autism no ebia or no so very possible say or bibi sana it's possible but Mr. Obani be no just say or no there like there's a problem and I say I'm money and bibisa. Symptoms na yeshen and then 7 ways to say they make first 3 na social that has to be present and 2 out of these 4 also have to be present. Now if you say yakase idea you problems or if you be out in the good PS or assignment what here or go school teachers almost some of these symptoms near them yakase okay. So only as I share maybe on the developmental level, like the age, it makes sense to say all struggle with Nima we and I say and this and I say maybe a trauma be no cool more na a issue be a bentinama nisubante sana until you share over time also. And yes, say maybe your statistics to maybe 1 week been near the no diagnosed autism like a share over the course of the life so far and they diagnosed autism. Into those are the actual symptoms of autism. Enti no say uhunu obi anim now ka say the way akra we nanim e bia na hweneti ana say no into autism means me no ni nkomo because what is symptoms am people once man ka say obi anim eti bibia anka ho uhunu obi say na no so now say because na no so no enti no autism again we don't know that because you name what else is going on with Onia Chrono. Autism itself, no symptoms, no, and no, I so encounter. Now there are many more autism. They struggle with language development too. But I think we have to be clear. Say Onia Akran Kasa, by itself, and yet like a symptom of autism. By itself, there are kids whose language is delayed. Maybe you better check cancer kasa, but I don't just say akrabi on kasa ebia autism. Obi ho be chance on kasa, but only autism or static kasa, any other symptoms of autism. Now don't get me wrong. So only akra still they need the help and support. Or also any speech therapy nibia, or also ebia so here occupational therapy, or also nyabia, Don't get me wrong, but I don't just say akra autism. Internet media be a catch parents say uhunu bibi wa oba ho bibi a leader. Start by talking to your child's pediatrician. Call one doctor. Now any ninko doc me hunu we what could be going on? Na doctor in church almost say, given say ebi oba no ye won 3 weeks early no. It makes sense to say ebi an kasa no a delay by some 3 months be. Yen no another 3 months yen no ye man me refer o speech therapy kakra munye we ni yen no. Okay, doc say I started kasa but only obi a niagro, okay, so I one started kasa and temodie. Possible say I feel na was using at the next level of things so I can once again no yenye we one either all this every step of the way no only doctors need in community or more the supporter we here then you do a certain age now for you say okay CCRDS symptoms of autism okay now we have enough to say but diagnose with autism. And I say ubedu baby na when we say see our kasa or started to kasa no, especially your core school now when you other people are when you practice when you like social interactions you who say like this kid is very social or share other people and how they deal with transitions now because say and obi a co-breaker obi a intro tantrum or also is along just fine we are not seeing the symptoms of autism now then it sounds like difficulties na it's more along the lines of language delay na any autism. It's not just any autism. Oh, it's ultimately no. Nipa ose or your best friend, or pediatrician. One akra no ne pediatrician, the doctors any call regular checkups. Uhu bibia so amesrel emfere. Kubisa o doctor no question. So me misal doctor question and then na like your doctor should be obia. Oh doc, me who say ebi akra no you feel cry na so far the potty training no in see so. But if you offer say can doctor no because say ma me born into no. Onka into doctor no cry name says oba no onya ne potty training. And I say, obisa specifically, say, no, the potty training to say, oh, bibia okay, bibia okay, and so no, na, debia or don't son, debia or yet when your accident, no. Oh, yes, and a doctor needs me, wow. Until Mr. Rewa, who bibia and fine, so when the doctor ninkomo, a doctor and show say, okay, we're normal, we're possibly problematic into, you know, yeah, observe it, na who say, would do baby a doctor and becca say, okay, see, baby, I don't know, I really suspect autism is possible. Because psychologists or on a specialist no na omonya full evaluation no on your mama or diagnosis no then they depend on where you are no with the diagnosis there may be some support available for you and then you can kind of get the referrals from then on right as in nema yes to diagnose autism in here and as I earlier said no you diagnose autism na we no you share how much impact akwane functioning na ya share say other things and so in the mixer US hand your autism you tie autism evaluation na your IQ testing count. Then you between actually say okay, the intellectual functioning, you know, baby also above average, you know, like there are many people who are diagnosed with autism now or more intellectual function. Just yes, and adrenaline intellectual functioning, you know, very, very high. Oh, you know, ube sa akrabisa or here deal school but in the social skills, form like when in for school. The grades need the perfect because when no school when you be a near the kids in the school crowd think say he's weird. Oh, this kid is so weird. They can't almost train school, but he's really, really smart. Oh, and no so able to a presentation of autism. Oh, now me say a big presentation be a change, but the American question say you move when we think about autism, baby, a drink corn is half of the problem. Oh, because what say now you must say him. Then baby crying baby, our band strength one. Why do you cry alcohol? Because who do you hear and say to say the brow can be quite a graduate I could aqua pipe and as a quite German. So that be out to suffering chain because Dr. Kacho say about autism until you're losing sight of the possible strength our band one no build a free home. Oh,
Doc, thank you so very much. And the school out there, school way, yeah, wrong ways I'm saying this is a failure because information now what disseminated would their mind no dear. I think say if we should build on these information now, beer or what's that situation no will get better. I mean, you bet me abwan. This is to tell us say young parents no and our caregivers no, we have a very big role to play. Just like you were saying, and when you began talking about Akran, I didn't basic no and yet Akran fault to say situation no woman sir. This brings me to my next question. Say, should we be blaming ourselves?
Maybe in fact a Kofi 64 question in the area so I think they've been on Kofi 64 Mr.
Okay. Okay.
Kofi,
would say and can't unmute. If you can hear us, unmute and put your concerns across, Kofi.
Can you hear me now?
You sound far.
Can you hear me now?
Yes, we can hear you now.
Okay. I don't know. I think this is a very academic topic, and I don't think probably I'm equipped with all these terminologies that you have. But I just want to throw a couple of things out there because I know whatever you are saying is on point. As a doctor, I can see you are a doctor, so probably I think you have been trained to be able to manage all these symptoms that science experiment is creating among the population. But my question is, like I said, everything you are saying is on point. We have to manage these things, identify them so we can manage them properly. But my question goes to the fact that is autism manufactured? Because you realize that there is a talk among the health services, what do you call it? The HHS, where they are talking about the fact that they believe there are too many pani a yɛwɔ yɛ man at birth that are causing all these problems? Is there any way probably we can find a way to reduce all these pani and yadi na yɛwɔ nkɔlaa no? Because some of these things they are there for a long time. They become generational. Because me gidi say me mommy ye wo no pani, me papa so ye wo no pani. So it can pass down whatever the effects are. Because like I said, some of these are all science experiments that have gone wrong. So now doctors are being trained to be able to manage all this stuff. So is there a way we can probably hit a reset button for the sake of the culture? So at least some of these things can be reduced among
Right.
countries where wealth is not so much abundant.
Let's do this. Right. So say we all have to kind of realize the levels, right? There's what we actually can do and can control, and there are certain conversations that there is not a whole lot we can do about it, right? So let me throw that out there first, because maybe it means now, and say as a society, we should no longer be taking vaccines, or we should, and all of that. So there's that. Now, what I can say about the connection between things like vaccines and stuff like that, and autism and other developmental delays, and then to say consistently, studies suggest that there is no significant correlation. Now, no, that's the first thing that I would say. The second thing, so they say, the vaccines, the main fun say vaccines, no puna, be a side effect to be some of the behaviors na you friend autism na. So vaccine, no, there is also the risk there. Nkran say no so almost school e sha ase na so wan komo mo flu shot yeah mani ma school because yent na homo no mfa yare e me obi ba because obi ba immune system nya flu keke ebitimi ekun enti yent na ho say wo mpesa oba benya autism ti no wan ma ne flu shot na ne flu shot no oba school na say or the flu no ebe ma obi ba ko because wo mpesa oba benya autism enti as a culture and means na hanka say yeah, oko near come out about vaccine and yet because the reality on the ground is especially here at the US no one thing about go school because you bet just certificate of vaccination no and obana go school. Already you'll be a by me sometimes no sound common and ko baby because it's not catch us say a possible say vaccines no course okay say a possible crana. What do you do? Because why am I about vaccine at school no one call? Because into you are so worried say be about possibly vaccine be man autism intino o manengo one manango flu shot flu regular flu na hwenia e be come back. Intino we have to be careful with baby this ankomo iko. Like I'm sure say obi baby say me pair while we on the topic me fan also. Obi baby say me pair say what you call it C-sections also autism ana. No, a question about TV C-section autism ana. So yet na haka say C-section ebema oba enya autism. Not just the yaka kusi and say as a parent no say oku hunu wakwa also chim doctor say okay baby akwa na no e say C-section na because doctor me pesa no me pesa me babenya autism ntino ma men trying chim what did ma men trying chim sa na sha woni akwa ni na everyone sa intime sa nkomo na yedi say C-section na ema autism anano debi o ha me bisa mo say ye ka akusi say the advice becomes, of course, so when you doctor no nurse, only come like build a relationship, especially you want the access to know. Find a provider originally now build a relationship with them right from the beginning. No only come source them out. No who say, okay, nipa we dem originally or to me for meti obisa me bibi so making kind maybe say bisa ho na make obisa questions. Intino say oni akrona wahye wa bedu samre so oni akrono eje wa wo upia na so oni akrona ka say okay baby e dre die ya nhwe ni ya obehwe akora no na so obeka say mate say this session ebetimi akoso A B or C intino ma men kwachima again wanhwe ni ya o de chim sa no na afi no because e bi o ha bia baby akora na akohye no e bia oxygen enko ne brain mu inti akora na struggle. If a child goes through a significant period of time when your oxygen to the brain, and also to lead to things like cerebral palsy and other conditions. I know said they will maybe doctors be a bit talk at you say, oh, yeah, C-section, one ABA in here. But in time, I say, Probia or trust no, to say, I only a corner the C-section back. Let's just wouldn't say, yeah, Hogan so, and this C-section never. Oh, and you know, like I want to make sure, say, yeah, in fact, at this point, what feels like, kind of conspiracy theories near, I don't know, because studies, interest sanity. Oh, indeed, I hear you with the concerns that you have. I hear you with the concerns that you have. Because, yeah, what should I run there? See, say, okay, Charlie, I said, Nancy, you take autism, you take a one pa, you take pa, and maybe a first, no, not a way, but these days it's getting closer and closer. I get it. I get the frustration with it, right? But we have to also be able to direct the conversation from trying to avoid having a child with autism and how to, I mean, I think that, I guess, not necessarily move the conversation from, but at least young fan can say, when you have a child with autism, how do you manage it? Right? So I think that and no, a better use of our time, honestly, than fighting about vaccines and all of that, because especially when now you make any policies in our state and stuff like that. We have a few people here with questions. I think that Ben came before Colombia, and then Dansoa, and then Ekuya Nibaba. So Colombia, Mr. Miente Benis, now you are. Hello, Benis.
Hello, Doc. Thank you so much. My question is, when you've been diagnosed with autism, I had to say the ODA and free also that even though you get better, to me free also say now you are no more autistic.
Okay, so that's the question. Say if you've been diagnosed with autism. Well, so there are two sides to this, right? Whatever diagnosis that I have, I am me and Kasame health information. Man can't you will know and it will be your business. It is semi amity hey, you diagnosed me with ADHD. No, semi me catch them. So man can't money. See, in movie I diagnosed with generalized anxiety disorder. Now I'm a cancer, you name and then sem. Yes, the diagnosis will be with autism because any idea econ. Meaning, say, even if like the way we are all living a life, like symptoms, and also a significant issue or impairment in their lives, technically, they still have autism. And no interest, say, only a chrono, ever like a so that was so necessarily because that was so interest, say, what I say, because if, for example, say, apply a diagnosis with autism, medical school, ABA, or struggle with school, to make our teachers and say, oh, by the way, the kid has been diagnosed with autism. Thanks, Dr. Tanisha, for the heart maze. I'll tell the teachers that, oh, by the way, the kid has been diagnosed with autism. So if you see behavior, A behavior, B behavior, C, it probably has something to do with that, right? And maybe we have conversation about giving the child some accommodations. So at that age, telling them about the diagnosis, super helpful. If my child over time learns a lot of the social skills, they seem to be doing well, and it's time to go to college, I don't need to tell anybody at the college that he's been diagnosed with autism. If they seem to be getting along just fine and they're doing well, I don't need anybody there to know something about autism. And if I don't tell them, it's my child's protected health record. It's the end and so because nobody there knows it. Because one, it will be their business, and nobody there knows it. You understand? And Bernice, while I understand where you're coming from with the question, it also is like in CP, you understand? If your child at 20 technically still meets criteria for autism, if they're doing well and the autism, especially that they're not exhibiting symptoms that affect their functioning in any notable way, why does it matter? Like again, like I'm saying, as I'm sitting here at this, I've been diagnosed with ADHD, right? Okay, if you know that I have ADHD, what you go do me? You understand? And damn it, so, but it not be your problem, and I don't have a problem with it either. You understand? Dennis, I don't know if they make what I say.
Me patron Matthias, but now me person me say, and so to me say you are no more an ADHD.
Correct.
And now say you are no more an autistic.
That is absolutely correct. Yes, autism isn't one of those things that gets cured or like you no longer have it, right? Similar to ADHD, I will always be someone with ADHD. at this point in my life, the symptoms don't probably helps that I take medication, but the symptoms don't significantly affect my life. So if I don't tell you, you may not know, right? But I still, the ADHD I still have, right? But again, like I said, it's more of, it's not a huge problem like that, because again, you don't have to tell anybody your story, right? You don't have to tell anybody your child's story. I appreciate the likes of Abrefi and Mami Ajwa and the people, because they want to, make autism conversations more commonplace. So they say, I don't care if you know that my child has autism. I want more parents to be comfortable with it and in this, right? By all means, right? But you don't have to, right? So really, eventually, it's not that huge. I don't want parents to worry about it. Say, intimate autism, no better like they will always have autism. Yes, but it no be anything like that. All right. Now, my wife is on the panel, and she wants me to do Pasha for her, but I don't want to. I don't want to do that. So, but I know she will understand. So we'll go to Colombia, and after that, we'll come to Dansoa. Hello, Colombia.
Doc, good evening, panels, and appreciate your time with this topic. For me, I'm really passionate about this topic because I've got a son who is autistic, and I've categorized my discussion in three main categories about we Black parents, how we are not ready to accept the condition when our child is facing a condition because of what we call stigmatization, because what Lena is going to say about my child, what Akuya is going to say about my child. So because of that, I always hide the condition of my child rather than seeking for the assistance that my child require. And I think this is where most of us are failing our children, because the help is out there and we are scared of going to get the help for the children. However, people are taking disability allowance for the same condition from the government, but they are trying to hide this same condition from people or seeking for the assistance. So for me, we are trying to know the causative agent of autism. That is not my topic, and I don't think it's any importance to me, because whatever causes autistic, the child has already got it. However, how am I going to manage it? How am I going to make this child okay? How am I going to understand
Colombia,
his
let
condition?
me pause you ever so briefly here. Like, there's ongoing research trying to better understand what causes it, right? So that we can all try to, if possible, prevent it and stuff like that. So that one day, like, and it's ongoing research. So I don't want people to feel as though we don't care what causes it. We do. There's ongoing research, right? But I think many times when we're having the discussions, your child already has it.
Exactly.
Right. And at that point, then, like, why are we worrying so much about what caused it? How do we manage it? But I agree with you. Like, baby, I also had attention here for to continue. So continue.
So for me, where I started, I particularly draw the attention of the pediatric to let him know that no, my son is developing this condition, and I suspect my son is developing signs of autistic. And he told me it's early stage, and I said yes, I understand it's early stage, but then the more we pay attention to it, then the more we can do something about it. Because now, I understand most parents, especially single parents or parents that we are more busy, when we give birth to our children, we introduce the children to more visuals. When I say visual, how do you mean? TV, cartoons, tablets. So it gets to a point that the children decide to be more communicative with visuals, like Coco Melon, whatever with this. So it got to a point that where they start losing eye contact with people, with normal people, where they start not talking. When you talk to them, they don't pay attention to you because they've already developed some interest about this visuals that they got on TV. And this is where the development stages that I think it comes from. So because ma'am, if you know I put my son in front of the TV, I can go to the kitchen and cook my benquine, cook my wake without no disturbance. And we think the child doesn't speak, but we've introduced the child for so long to visuals that it's causing a lot of things into the mind. And this is where I started it. I did the research about it. I'm not a doctor. I'm just a normal military person who developed interest about this autistic whole issue. And where I draw my conclusion is, if I stop my child...
Colombia. So some of these conversations are honestly very, very tricky, right? Because on one hand, we don't want to make any parent feel like when I'm autism because who the screen is seeing it, right? And there's also like our daughter, for example, a lot of the things that she knows, and you know, like every now and then I post something about her. A lot of things that she knows, I didn't teach her. She learned it from Miss Rachel on Songs for Littles. Like a lot of the language she has, a lot of the speech things she has, she learned it from a tablet because it was a speech therapist who's doing the thing, right? So I want to be careful to not completely demonize screen time as though like if anything said like we have to be careful what our kids are watching and how much time they're spending on it 100%, but also what I say balance in here.
But
So
Doc, I think maybe I draw my from is the developmental stages of their mind. You see, baby are omunim what they are doing, but we introducing it to them. We say any day rather than say when they grow and develop interest in it. Unso muju baby are omankasa develop interest. Because me Jaros is very organ. Mini baby question organ free. On one share ne tablet so ana say we bought to the highest level. Mini baby question free. And see, me can say from the initial stage at the age of 6 months, 9 months, and you know. Yen mumuna ye more access to those facility at that stage. Because it do sad then ya answer omuntimi nka so mbekwa akwohwe. What I say? So or 3 months so one so TV o ntimi fa remote nse chinchina so TV ye dey e ma no. Ba enam say ye soma omo a omutimi pay attention na ye ntimi nya adaje ye ade ye ho beto ye nti no. Na ya mana be ye as a culture and as a tradition and as a routine ama omo. Oh, it's a very routine ma omuna na abeye omo part of omo life. I say one ade no pena a communication rather than ne mama and ne papa and ne nua. So that one is also another attention. Be am person be a parents no. Ye be obi ofufro na say bi obi say ya. Oh, for bi anka obetimi pay attention or kakra more than say obi na aye access to say baby the when they when we we ho hwe enye dey at that point. But going forward.
Yeah, that's fair. That's fair. Mr. Columbia, I'll run it up, man.
Yeah, Doc, see, maybe then say, as parents, no, yen try to accept the condition of the children and look for the help for them rather than say, as you slow, ye this year, yen person nipa be who say, kwaku obi, and I say kwaku autistic because me so be, me try mu kra me so be can autistic as a man person me tie the nipa na ye can because e be an technique ba could be ebe you so ma gyros ama aboa one way or the other. So let's try we whole community say can be so once I'm happy to listen to it because one topic be and also be experience bit me aboa me ama me so me ba developing certain stage. So I think that we shouldn't be scared or we shouldn't say this year yeah man because is there, the help is there. Let's seek for the help from other experienced people and help the children.
Yes, sir. Yes, sir.
Thank you, Doc.
Thank you very much. You know, and again, maybe somebody to also say the screen conversation of balance is everything, right? You know, because especially that's why I say diaspora now. The reality on the ground is it'll be as much. Oh, a bed they say be as much time as you would like for ground to debut or not. Charlie, also TV for a few minutes here and there. Wait me a breathing crack on. But again, balance is everything. Now, of course, you have to know your child and their own age, you know, difficulties and so how they're balancing. So see a Drew, Mrs. So that's so I can say we had, and we come to a clear, and then I think after that we go to music only and then jazz. You know, hi that's all.
Oh, get away.
It's too.
Okay, so before I talk, I think let me just say that hey, Yerika Fantana, Yerika Brofo.
That's fine.
Okay. Let me just say that I am not just Lewis's wife. I am a critical care nurse and I am a psych mental health nurse practitioner. So I also have that knowledge, and then I have 2 kids who are on the spectrum. I heard like a lot of things that I just want to touch on a few things. First of all, like somebody was saying that like it looks like autism, like a lot of people are being diagnosed with autism now, which is true, but you would also like, especially if you're in the US, this DSM, I don't know if the other places they use a DSM also to diagnose, but the DSM that we're using now has been revised to include some conditions that were at first not called autism spectrum disorder. Like there were conditions to be not all conditions on their own. CCR was Nininara autism spectrum disorder. So if you think, like if you see that more people are being diagnosed with autism, it's because Obia and Ka a few years ago they'll be diagnosed with Asperger's, for instance. Now they're being diagnosed with autism spectrum disorder. So there is that. Secondly, I want just to touch briefly on the thing with vaccines and like what Louis was saying. If let's keep in mind that vaccines have been studied, vaccines have existed for so long, way before all of these things that we are giving to our kids now. Because these days there are so many things on TikTok that people will tell you, oh, I give this to my son and they started talking. I give this to autism. Vaccines were studied years ago before those things. So if you are comfortable giving your child a supplement that you found on TikTok that they started producing from somewhere, which a lot of them are not even FDA actually approved for the things that they're saying they do, don't take a jab at vaccines. Because those things have been extensively studied. Also, vaccines.
Real quick, let me just say I feel very proud right now. Thank you. Keep going.
I say I 7. Also, vaccines, like even when the COVID vaccine came, right? And like this may be like the COVID vaccine. Even healthcare workers had like their issues, like, oh my God, like it looks like this thing was like quickly developed. But as somebody who works in the ICU, I am telling you that obviously you could take the vaccine and you still have COVID. But the difference between the survival rate of those people that had the vaccines and had COVID and those who did not have the vaccines, it's significant. Like it is significant. So, and some of us are comfortable not vaccinating our kids because we have what we call herd immunity. Nkrofo bebree a vaccinate one ba. It meant in Kayerba and Nkrofo bebree wonyinya. Emma like him from a woo in time because Nkrofo bebree wa vaccinate one ba no. I will say and vaccinate one ba. It's probably going to be okay because it's not spreading that much. Into say I will unvaccinate one ba. Na say like 1 year and now bibia. Thank the people who vaccinated their kids. Because that is what has given us that herd immunity. Again, there are 1,001 people who vaccinated their kids and they didn't have autism. And then there are also people who did not vaccinate their kids.
And their kids have autism.
I know somebody who did not vaccinate, who did not give their kid a flu shot. The kid had a very bad flu, had seizures from the flu. And like now, like their brain, like they're not going to be the same again. So there's that. Thirdly, like Louis was saying, like there is so much research going on for us to know what causes this. Like coming back to why there are so many people who are being diagnosed with autism now, it's not just autism. So many people, again, like from my work at the ICU, like I was telling Louis some time ago, I was like, babe, the number of people who are being diagnosed with cancer is crazy. Like 1 out of every 4 people, will have some kind of cancer. It is crazy. And it's because in Zama Yezi, the things that we have to put in the food to make it more accessible to people, to make the shelf life of the food longer, a lot of that is not good for us, but it is what it is. It is true probably that there are things in our food that is like, because it's a neurodevelopmental thing, right? Which means and then there are the things in the environment that are affecting it. There are probably things in the environment that are like affecting things, like we are talking about climate change, we are talking like a lot of things. And I mean, it is what it is. You can do what you can do, like watch the things you give your kids and all, but then like don't, if it gets to a point where you are so, then you're not even living, because yeah, it's sure to be about autism. And it's like these days anything could give your child, anything could give you yourself some kind of cancer. How about that too? Oh, and then I think the last thing I also saw somebody comment about that I wanted to talk about is that Obiri Kade, Miba or Mano BB or something happened and Afrabano doesn't have like the signs of autism anymore or something. No. From my personal, and this is even me come like from as a parent, I have started like I have taken my son to see a neurologist. And of course that was in my area of expertise, so I can, but then and then they are running genetic testing and other things because apparently there are some neurologic conditions that can make like the signs of autism worse. There are some genetic mutations that can make signs of autism worse, and some of them are fixable. And then Eshem of Frama who present with like signs of autism to her, like how Louise was talking about the fact that they are so picky in the foods they eat. The fact that they are so picky in their foods they eat, and they don't have half as much of the nutrients that they need for them to develop properly. And I use like balanced diet simple. How many of us even have the nutrients? Like we are having to take supplements to make things complete. Then talk about the kid who only eats like granola bars all day, every day. And if they don't eat a granola bar, they're not going to eat. Are you going to let your child starve? No, you give that to them. There have also been like some studies which are talking about the fact that, a lot of kids who have autism, no, there is actually like, if you look at like the amount of folic acid in their brains, it is so low compared to neurotypical kids. So there could be a correlation between this brain folic acid and the symptoms of autism. And so with all this research, like they help, like, so you may have to give your kids some vitamin supplements. Again, don't give your kid anything just for
talking to their doctor.
Talk to their doctor first, because this is something that came up on TikTok. I was talking about with Louis. I was like people are giving people vitamin D's and vitamin K. All of these like A, D, E, K vitamins, they are fat soluble vitamins, which means your body doesn't just get rid of it; it stores it. So don't just take vitamin D and vitamin K without checking your levels first, because
you would first check and see that you need it to then take.
Yeah, because they are fat soluble. Like the water soluble vitamins, you can take it, and if nothing will happen, your body will just pee it out if you don't need it. But the fat soluble vitamins, don't just take it because people are on TikTok telling you that you need it. Because if you don't need it, you're doing yourself more harm than good. So that's what I wanted to say. And again, thank you to everyone for being here, and let's all learn to do better for.
I'm looking for something to clap for you, but I don't know how to do it. But host, clap for the person that's spoke. Yes. Thank you. That's so happy.
Applaud.
Your husband and your friends are very happy to have you in their lives. Yeah. Let me go on my small soapbox. If you are a nice man listening in the FYP and you don't want your wife to go to school, now your business. Thank you. So I think, sir, if there are no other questions, we can Akuyaniba, and then we'll come to music only. Akuya.
Yeah, hello.
Hi.
Good evening, everybody. So I wanted to talk about the fact that we spend more time blaming people rather than finding solutions to our problems. Like we blame maybe them as the mother's fault. I remember when I gave birth to my child preterm. He's not autistic though, but he was preterm. It was 0.9. He lost weight 0.7. He had PDA. He had a lot of complications before. So we stayed in the NICU for 3 months before we got out here in Ghana. So when
sorry, go ahead. I found the clap. So
you found the clap.
Delete clap for my wife. Thank you. Yes. Go ahead again.
So when you give birth to a preterm, when you go to the NICU, they try to tell you about some of the complications that may come up as the child is growing. So there are a lot of families that come together. At the end of the day, the woman is blamed that she's the reason for it's her fault that the baby came preterm, or it's the fault that the child is going to get hydrocephalus or be autistic or have Down syndrome. So then it starts from there. So I think that if people are listening on the FYP, people are listening here, if we are more supportive of maybe our spouses, our wives, families are coming together to be more encouraging rather than try and blame the woman or the person who has given birth and say it's their fault for the child coming the way they came. I think it will go a long way to help with the emotional support. That is what I wanted to talk about.
Thank you. And that's a huge point. Oh, okay, some more. Like so many people spend so much time trying to figure out who is it your family that the autism is from? Is it my family that the autism is from? Oh, is it? I was on a podcast once, and somebody asked me that there's an actual case where a man said his wife didn't act like a Hebrew woman and do vaginal delivery and C-section, and that's why they have a child with developmental
You
issues.
don't know. You don't need to stray too far. Like I experienced the same thing, so I know what you're talking about. Yeah.
And you know, like when you are already bashing your wife like this, where is the peace of mind that she's going to have to provide the best possible support for the child? Obispo Hono started sign and just will excuse to your journey. No. Into a and that cross me got off antaba, or maybe you were jaho, when jaho. Yeah. Why you Hebrew woman? Oh, and that doesn't help anybody. Now, because I cry no hear papa, I cry no hear the additional support. Now we so wo okuno. Oh, into what you are not bringing the support. Also, I was saying from life. So me in my mind, I count it as a double because not the same. Your support no day, your exit too causes pain, and then your family struggles because you think it's as a Hebrew woman in Kewasenka or vaginal. But even though no, only a hospital. No, for doctors is some C-section. Doctors need decided say that's what's necessary because yes, I will.
For me, I had severe preeclampsia with severe features. I was losing my sight, so they had to take the baby out immediately. I got to the hospital, so it was a very tough
somebody
time.
like you. If they blame you, what was the expectation saying Kajana when infra? Like that's ridiculous. But that's probably a conversation for another day. But
So I feel like more support.
And
will go a long way.
And people will be asking, don't take the blaming because people will say it, right? But please
Oh
don't
no,
say
I'm fine. No.
Don't internalize. Okay, so,
but while I was there too, there were a lot of women. I don't like to at Rich Hospital. There were a lot of some families left their wives, and it was a really hard time for the women. It was so depressing being in Niku, plus having a preterm baby, having to wake up every hour to feed the baby, and then the depressing period. There was just one man who came in with his girlfriend, and she had given birth preterm. He was always there. He will be there. He will make sure if we had to go buy drugs, he would take everybody's number and take the list, the prescriptions, and go and get it for us so that we do not have to go out of the hospital because we had preterms we had to take care of. It was just a horrible time. I'm like, to here in Ghana, it's very difficult for a woman to give birth to a preterm or have a child with special needs and be okay. There are sometimes you find family members, even the family members from the woman's side, ganging up against her, calling her a witch. It was just horrible, honestly.
Big
I feel like
Kafra. All right, thanks everybody for coming on. Let's listen to music only briefly, and then we'll come to our. Oh, so there's music only, Prejune, and then Abrefi. Music.
Hi everyone, good evening.
Good evening. How you doing?
My background the very rough kakla. Any pan 88 shout say ambulance never ninety. I think say you manage.
Yeah.
And I mean to me so in Johnny ha. Anyway. Sorry. Jadi, sorry. I'm sorry. There is a you me patch media make a tree because English now I can't really express myself in properly.
That's fine. You had your man I do Saturdays cry and Pebble.
Sir, may I say? Last time I came across one of the live say no and I said conversation now based on black people no I said autism no facing it more. But I'm here to challenge say is because area hana meeting no mostly for net Asian for no it's me bunny school special needs school no mostly woman and almost those and white people.
Mr. Music, Mr. Let me interrupt small. Yeah. That's why Kofi Kinata has followed me back.
It's a lie.
See, I don't know if you can. Oh, you can see.
And you bring Betty Badger.
Kofi Kinata started
Mister, and you
from
bring Betty Badger.
out of. Let's put that one off screen. Mr. Music.
Obi Amon is my dog. Dog is trending. Obi Amon is my dog.
Sorry, people. That's how ridiculous I am sometimes.
That is good news. That is good news. That is good news.
Mr.
Congratulations, dog.
Okay, can I go on? T?
Yes, please.
Julia, can you lower the
Yes,
TV?
please go ahead.
The mechanic say it's not by yana then because as I'm for taking you say yeah blacks no most no. I don't think say yes sir because I have no omu case no crowd be a very serious so it be omu cases no. Oko school na yeah. And then about what we are talking about no say a bit more based on this based on it. Me dear no. I took all the blame on myself because na me yare so I had this therapy which is sometimes when I'm talking about myself I become a bit emotional. Yeah, I'm a cancer patient myself. So I had the first therapy. So after second therapy, no, which is by lucky maybe radiotherapy, it wasn't chemotherapy. So luckily enough, yeah. So after my second therapy, no, and after a few months now I noticed menyam. With that now me work running in now say I was scared and I was expecting more than this. Even post me no yeah, when you know autism, I took all the blame myself, and I become so stressed, and I even fall into depression because it was a lot. You know, I was also scared. Say, I myself now have underlying health condition. How am I going to support him? Because in the case, no, so even 1 year you notice something is wrong because very age was high even until now. Couch is couch everywhere. Of course, someone have to follow him 1 to 1, 1 to 2, whatever. So I was so scared. By God grace, lucky enough, say baby, I have support her, and I was also lucky. And I'm here one of mother no so I mean outside there. Make sorry, say me use way. I don't go to Ghana for baby. Sorry, say me yes sir. Yeah, say enemy GPDS say why by family friend. Just say me changing his sign to all his or say all 5. As when all his diagnosis done, or course special in school, or nursery, no moon ye to me fight here. Emma school no 2 to 3 years cry no one diagnosis because as I may accept it, I myself I was afraid. And I was looking for support. It is an imaginary. So I feel proud for myself. So I will maintain me auntie. My auntie was pushing me. Yeah, because of way, but I didn't give her. Yeah, I didn't give her the yes. I mean, didn't best any suffer for any the honey way flow. You don't want to spend the money. You person over here, canteen. And then the me here. No, they say, but I didn't. Any no near day. So and Munyanka, I mean, see, schools, so they are giving him all the support. He's fully non-verbal by visual cards from special speech and language, occupational therapy is there. He's a typical worker, physiotherapy is involved, continence nurse, he's still on nappy. Like everyone is doing their part, which is, very grateful. Community, no? Yeah, did this. Thank you so much. Me who said, some mommy phobia almost so awareness no ebua any the mu ye nyina nti monko so na momboa ye ya na momboa no omonti ase no omonti ase no mu say this is it aberie enya something be ye careable wo care so obi se mema na do no it's not like that manageable how I will be manage no and I'll be positive results no. She said first me ba no friend no even until now he doesn't respond to his name, he doesn't care. By once, sometimes, say, JD, sit, with me, Tanase, with me, Banty, which is I'm very grateful. Yeah, made that say, that's a
Thank you so much for sharing. Oh, I brief you time as well. Will be a friend, how are you? Thank you so
1
much.
second, but my problem near constipation. The last time I requested that, I'm still not getting there. Yeah, you been see, or pediatrician, of course, or dietitian, everything. They've been giving more because I don't want to give him that. And I'm trying so, but I know I have my journey. The dieting, no.
Parents, I'm glad to say. I think it's always a bit encouraging when you can see progress, even if it's ever so small. Oh, inti kakra bi na wo ye no se wo hu progress wo nto de ma ho mre wo ne omoni nkomo omo suggest a dro bi na wo mpese dro na bisa almost
What make it difficult, say, or you're picky? Yeah, or you're belly picky, almost smell it, almost sniffing them. Yeah.
Woman fiber now
Or
on
you're
person
picky.
bedi.
Well, here do you answer we didn't so you can imagine. Yeah. So yeah,
Don't worry,
first child
you'll
is
go a fee. Kakra.
and then the money difficult by we honest. So yeah, that must say why that must
Yes,
say.
yeah, that's step everything.
Hey, TV the back from wait, let me that say.
Hi, Doc.
Everything.
Hi, Doc.
Hi.
Hi, everyone.
Hi.
I am so happy to be here. I say, ceremony be chair drinks near there. When I see something like this, just a mini J. Me Patrol, first of all, if you could permit me, I could say something to music. Music, I know, sir, at times, giving your child medication and stuff, we get a bit about it. But with the Movacol, I think say if your child has extreme constipation and you've tried diet and stuff that are not working, no, I think at times it's only right say we supplement a little bit, like using that Movacol to help the bowel movements. Now, Edru baby, you can wean him off it when like he's getting regular bowel openings and things. So I think say you said you didn't want to use it, but it will be very helpful if you start using it. A bit to me about because constipation, no, it causes a lot of behavior,
Okay.
because
Yeah.
of a lot of discomfort and things. And it might not be fair for him to be going through
Oh,
that.
can I chip in? Thank you
Yeah,
so
tell
much
me.
for that. I've been giving him, but because without the movie code, that's how I mean, even if you and the vegetables and fruit, may blend it, I hide the food, no. Some of the man, but it's still not healthy. So more we could have been giving him. By
Yes,
so
sir.
one from what we could now 5 days plan on call toilet. Trust
Yes,
me, we'll
yes.
give me it. I've been giving it to him. Yeah.
Yeah. I wanted to say, sir, so what
Let
they
me to
man,
take it.
you keep on doing it per doctor's prescription. We won't say I feel the bow will get used to that regime and things, and hopefully no start to say,
You're
then we
right.
start trying new fiber textures and stuff. Into won't say oh then you just start taking it, be start to say we reduce yeah, with the advice of your doctor. Then hopefully we won't say we're free. So and also try to let I know so you've seen professionals and things, so you know all
Yeah.
this.
Yeah,
Give
yeah,
them a
yeah.
lot of you kind of saying fluids. And
Yeah.
ABR maninya active more. Say ABR say trampoline kit we be na beto wo fie na we hu we so na say bibi bi or the be run run.
Obeka TV actually form no. Obeka TV actually form. She's
Now,
probably
for the
plenty.
active media, may advise me for active, but it's enough. Couch to couch,
And
TV to
anyone don't
TV.
know.
Ah, my
No,
God.
yeah.
I know,
If
first
you
school cloud, you're 2 to 1, no, nipper 2 in a dinner,
I
it's blend,
know,
blend,
and yeah,
blend.
easy, yeah. Ain't you one cause you know it all, but with the mobile,
Yeah.
keep up with it. Like
Thank you
be
very much.
religious with it. Who
Yeah, I
say
think
you know?
I'm not following you properly. As we said, sometimes I feel so I may stop it because I feel like it's a chemical. I want to do that
No,
naturally, but it's not
yeah,
helpful. Like, yeah,
it gets like that,
you're
mom. But
right.
say, I dare a bit buana man, comfortable, be reduce behaviors. I'm a with me, I healthier. I think, say, and another thing to say, once I work, I say you're a bit a year about joining Ghanaians and whatnot. I
Yeah.
would say, on this TikTok, we've met amazing Ghanaians. Even maybe
Yeah,
I
you know,
want
yeah,
we are amongst a lot of amazing Ghanaians. So don't men write young Ghanaians off
Oh
because
no, time
and
to
yet,
time. When I guys say, "Been some
yeah.
about me call up,
Yeah.
now me to share my idea." I think say encourage others to also do better,
Yes,
for
yes,
them to know that they are not alone. Because
yes,
beginning, I was thinking, why me? This is the first time even hearing a word autism, but
yeah.
someone doesn't know. So I was sharing. I think say it helps. So I've been doing that a lot. Anyway,
And
thank you so
also,
much.
as a Ghanaian parent, you're going to or everything you just spoke about, and additional having your child being
Yeah.
having special needs. No, my friend called Mami Ajwa. She's also a Ghanaian. She
Okay.
has this support group, parent support group,
On
Ghanaian
the
support
TikTok.
group.
Yeah, I follow
Yes,
her. Yeah, I go
yes.
to her a lot. Yeah.
Yeah, and also so like she really helps a lot,
Yeah.
and it's not all about autism. At times, no, she pays a lot of
Mami
attention
Ajua
to
and
woo
a queer
parents.
mommy. Yeah.
Yes, yeah, woo parents, woo mental well-being. Yeah, this so what to me
Absolutely.
join in your group now, it will be very good if you have
Thank you
any
so much.
questions or anything. No, they are always there to help and share their
Thank you so much.
advice. So
Yeah,
please
thank you.
mingle with us because and yet,
Oh, I'm not saying that. Oh, I
Oh,
say
yeah.
even going to
Miss,
church, it's another
okay.
issue. And I will ban
Yeah,
her
yeah, yeah.
drink and I say we
Yeah,
can't even
yeah,
go to
yeah.
party. So It's better for me to stay on my corner rather than people talk. Sometimes mubu abem and abaneni so say no beach they will drone they will. Oh my God! Some people feel sorry for you, and so I don't like it.
Easy.
So yeah.
That's what I say. Now, Mebacho, because we have about 14 more minutes, we won't be picking up any more new people. Tanu Obi or Habia Kasaria, na around there.
Patrol Doc, Maria with milk. So I just wanted to just say
Yes.
something.
Yes, please.
Like I said, I get really happy seeing gatherings like this. Yeah, preachy, baby. You said say Kofi Kenata, a follow. Big ups to you. Just say, one kasa, you're a celebrity on your own. You don't even need people to actually call you one because whatever you're doing here, you, your wife, and Obia or joining Ubia every time you guys are on. No, I think say you guys deserve like something even more than Kofi Kenata following you because you're amazing. You spend
Thank you.
so much time sharing whatever knowledge you know. You spend so much time advising us and all that. And I think that you deserve more than that. But it's unfortunate, say, up ways, people rather praise things that I don't know. Yeah, but
I prefer
yeah.
But
Anyway,
thank you. Thank you so much.
yeah, thank you. Oh, I recently started following, is it Lena, the host? And I would say you are amazing. Like all the programs you host, all the professionals you bring on board, you guys are amazing. I just came to tell you, say, we shouldn't stop. Also, now when you're 2, when you're 3 followers, when you're video, when you're 20 likes, whatever, don't let that pull you down. Don't let that pull you off. Keep on doing it because you don't know who you are helping back door. Obiti baby or ferry so be in anima ba abeka ne problem, but they be also or tete baby no oti buanepa. And I know say gradually that person would also get some confidence and also come and join you and support you. Thank you so much for all you do. And I'm hoping, say, I do where any idea see any sooner. It's going to support our kids. Say, you knew how cramp now because of fact, phone so life. Obi said, this is autism, this is ADHD, this is this, Nintendo. Obi share obe treating accordingly. The stigma and all these myths and stuff that are going around. No. Obi tiewa, it would all die off, and hopefully our kids would have quality of life. They will be able to cope in their society that they belong to, and people will treat them fairly. So thank you so much to you.
Thank you. Thank you. And thank you for
Thank you
all
very
the
much,
input.
Abby.
Yeah.
Thank you.
And I think
Come here. Dale, put the phone off.
Miss Grace by us, Frank, New Love, and then Queen, and then we'll be done. Miss Grace. Oh, them are. What are I say? Miss Grace.
Miss Grace.
Oh, it's bread. You
Doc, yeah, mean sure.
That was so.
You hear these kind of education or Ghanaian platforms in do, especially me yanka, because back in Ghana now I was a regular classroom teacher. It's me yanka, me colleague teachers no. They will get this education and information because it that back home no, even the normal kids no, the neurotypical kids no, they need us to know these things to get this information to be able to help them in the classroom because the main information in no or boy and past parents as teachers on easy remember how they are more devices see maybe joining special needs now my learning support assistant is here and with all this knowledge now I have acquired I have realized that if I should go back to Ghana and be a classroom teacher, I'll be a better teacher and even as parents or boy and so that my million I'm no work and doc I mean sure na young quadrant young boy and who them can do I mean sure
Unsure, so that's a bit brave. All right. Now you call Frank New Love. Frank, unmute yourself now into you and you call Queen. Do not. You're around the app. Frank New Love. Frank, are you there? I muted you, so you'd have to
Frank
unmute
isn't
yourself.
there. Frank, I
So
tried
Frank
to
is saying, okay.
Oh, I say he didn't. He wanted like I think he mistakenly requested to come up.
Oh, okay, that's fine then. Let's hear from Queen, and then we'll round up. Hello, Queen. Are you there, or you requested by mistake? Which is fine. If you did, that's fine. No hard feelings, no pressure. Queen, are you there? Okay. All right. Now, okay, so looks like Queen is not available, and Amma Apre is requesting now. Amma, I'm going to accept you, but if you're requesting by mistake, that's fine too. So we'll hear from Amma, and then and then that will be it, and then we'll have to round up. And Miss Grace Bernice, if any music, maybe I may drop almost soon. It's because we are rounding up. Hello, Amma.
Hi, Doctor.
Hi, how are you?
Show. Mom, video been come across recently.
Uh-oh. What happened there? Well, Amma, I don't know what happened in the Pacho Seti and can't request an Abra back. Okay. All right. So while we wait for Amma to come back on and come back, thank you all so much for I'm blown away by the fact that we have averaged roughly 65 people for the whole time, like for a good, almost an hour and a half. And it always on my menu when conversations like this, or hi Primbel, or because I'm sure that now a papa ne nkomo foforo nkomo du ho de nkofo dipa na ejani na na I spend what time hey. Thank you. The plan is to do this on the second Saturday of every month with Lena, the host. So next month, what autism is and the myths associated with autism. Next month, you best spend the time on the early signs, a parent, na aza all day on. Like when you see those signs in your kids, what are the things to do about it, right? So that we can hopefully catch some of these things early, because early intervention can make such a huge difference, right? So that's what we're going to be doing next month, right? And now, as the time gets closer, I will advertise it. If you don't already follow me, I don't catch one sana. So my mayor, when you also, a checker, put your hit the follow button. I'm just kidding. But yeah, if you don't follow me, please do, so that when we post about it, you get the reminders and stuff like that, right? Lena, thank you so much, because as I mentioned when we were talking behind the scenes, I wouldn't do this if I don't have a host, honestly, because I don't like being on live talking to myself. So if I don't have a host, I know go do, right? So thank you for coming on board for us to do this. We'll take final thoughts from Benis, and then we'll take final thoughts from Dansoa, and final thoughts from you, Lena, and then we'll be done. Benis, any final thoughts, any final things to add? If not, that's fine too. It's just because you are still on internet, maybe sound.
Doc, me sanu name on me too
Yeah.
Oh, my final thing is to say thank you. We love you so much. That's Juma Oye. Encouraging, I'm an autistic mom. Encouraging, it's a boy, and I love this kind of life. Since in show, pa.
Michelle, so thank you so much. Yes. All right, Dansoa, any final stuff?
I think final thing I can say is to every mom who is here, to like those who are probably listening in, like music only, you have done everything right. You're doing everything you're supposed to do. So yeah, don't let all the negativity get to you, and keep putting one foot in front of the other, and it can only get better, right? Because the my way, but like it can only get better. So yeah, it's gonna be okay. Let's just keep moving.
Yeah. Well, and also to the fathers out here, please, when your child is diagnosed with autism, don't run away. The number of stories I've heard about a child who was diagnosed with autism and the father left a picture, it's saddening. It's me pot shop. Please, if your child is diagnosed with autism, it's not you're gonna be fine. You be present with your family and work on it together. You all are going to be okay. Don't leave your family. I don't know. I mean, who I mean, Campo. But please support. Don't blame your wife. Your wife didn't do anything, right? Don't blame your wife. Don't leave them. Stay and work through it together.
I mean, I think I was going to say that. Say, well, we're honest, so we're in what? No, I think. Now, hey,
Yes, Hannah, you make my life worse that forever.
where's it's a Hayden? No.
Na memu abotre you want to kasa.
Jerry, I come
Anyway,
in.
maybe why say maybe one of these days we'll probably dedicate one of the programs to fathers to come and ask questions. Maybe, who knows, right? But get the support that you need, because you need your support to get to, because sometimes it's tough, right? And I said this on the last autism thing that Lena hosted with Dr. Steph, that when your wife is pregnant, as a father, you have dreams. Me, the way I played in my heart up, I was looking forward to my child being born, so we'll dress up and take pictures, and do some things that people do with their kids on this social media. I was planning those things long. But my son is 7, he doesn't talk, and he couldn't care less about the camera. You understand? So it can be tough sometimes, right? So it's important to you need your space to work through some of these things, but definitely leaving is nowhere near a solution, right? So please, let's take it small, and we and our families will get there. We're going to be okay, right? So yeah, Lena, take it away. Let's
Yes,
round it
sir.
up and end the live. Yeah.
Thank you so much. And wonderful people, this is the kind of team I love to work with. At some point, my camera, everything will not just let me have my peace. But I'm so happy I was able to sail through to the end. This is not the end. We are coming back your way next year. January, the second week, the second Saturday. And so we would definitely want to see you back on. Spread the news, carry it across. We want to see more than 3 times the number here, next year. And I'm so happy people are getting to understand what autism is and they are embracing it. They are not shying away from it anymore. And for all those people like Dog and Nana Danswa who are putting in their very best to help us understand this, more grease to your elbows. Next year, we expect to hear even more. And so, wonderful people, this is where we'd want to draw the curtain. And we want to wish you a Merry Christmas already if you are one who celebrates it. And also, don't forget to celebrate Doc because Kofi Kinata is following him right now. And let's see what happens.
Yeah. And also, I think Print Bell is still here. Print Bell, if you're here, put a comment in the comment section so people will see you. If the shirt I'm wearing, I know it's reversed, but it says Autism Adapt Advocate. Oh, wait, it says Autism Accept Adapt Advocate, right? If you think it's nice and you want some, inbox Print Bell and she will hook you up. Print Bell, if you're here, give them a hand in the comment section so they can go to your account or look for you. But yes, Samatani offer. That's how it is. But apart from that, everybody have a great weekend. Enjoy the rest of your year. I will be back here on the last Saturday of the month with the ADHD live, right? And I do the Friday lives every Friday with Lady Bina as well. Hey, Charlie, me boy, so I do every Friday. The Friday ones are more kind of general conversations about mental health. Lady Bina hosts that one with me. Friday is at 5 p.m. my time. I think it's 10 p.m. Ghana time. And then I'll be back on this last Saturday of every month with the ADHD live. That one, my host has run away, so I have to figure out what to do about that one. And then we'll come back next month, same time, the second Saturday of January, with the conversations about autism. But apart from that, everyone have a great weekend, and I'll see you the next time I'm live. Peace, y'all.
See you all.